Imagine a wound that hasn't healed in 3 years, just sitting there, totally vulnerable and open.
Right, a really severe chronic situation.
Yeah, exactly. Now imagine healing that exact same wound in just a matter of weeks by essentially, well, turning your own blood into a concentrated, hyper-targeted weapon.
It sounds like science fiction, but I mean, it's actually happening right now.
It is. The tools to do this absolutely exist today.
Yeah.
But, and here's the catch, those exact same biological tools, those same centrifuges and engineered proteins, they're also being used right now to cook away wrinkles, fry sweat glands, and, permanently alter human anatomy for purely aesthetic reasons.
Yeah.
So, welcome to the deep dive. Today, we are looking at this incredibly diverse, honestly, somewhat wild stack of research that explores how modern medicine is weaponizing the human body's own biology to heal itself. We've got a deep dive clinical review on wound healing, a clinical breakdown of PRP therapy, a brand new list of approved medical devices out of Japan's PMDA, and a really fascinating study from Saudi Arabia on the ethics of cosmetic gynecology.
It's a profound shift, really. I mean, we're moving away from the era where we just sort of patch the body up, right?
Mm.
And we're entering an era where we actively hijack its cellular communication. But as we'll see today, when you can manipulate human biology with that kind of precision, the line between, healing a patient and enhancing a customer gets very blurry very quickly.
Totally. And that's exactly the journey we are going to take you on today. We're going to start with the biology of regeneration, then look at the cutting-edge hardware hitting the global market, and finally, look at the ethical tightrope doctors walk when life-changing healing crosses over into a really lucrative cosmetic business.
It's a huge topic.
It really is. So usually when you think about a medical diagnosis, there's this expectation of precision, right? Like engineering. You break your arm, the x-ray shows that jagged white line, and the doctor just points and says, there it is, broken.
Exactly. It's binary. And that's incredibly comforting for both the doctor and you as the patient. We like things to be visible, to be, neatly categorized so we can apply a standard fix.
Right, but when you step into the world of tissue regeneration, that x-ray machine is basically useless. We are looking at a therapeutic landscape that is completely microscopic.
Yeah, it's a whole different world.
So to understand how we are weaponizing biology, we first need to understand how the body's natural defense system works. According to the clinical reviews we're pulling from, there's this 4-part, highly choreographed biological ballet to healing any wound.
Right. It's hemostasis, inflammation, proliferation, and remodeling.
Let's break those down a bit.
Sure. Think of it like a coordinated emergency response. The moment you are cut, hemostasis kicks in to stop the bleeding. Platelets rush to the site and literally clump together to form a physical plug.
Like sandbags in a flood.
Exactly. And almost immediately after that, the inflammation phase begins. Your blood vessels dilate and white blood cells, leukocytes, they just flood the area to hunt down bacteria and clear out all the microscopic debris.
So they're basically the cleanup crew.
Precisely. And once the site is sterile, the third phase, which is proliferation, can start. This is the rebuilding phase. Your body literally constructs new microscopic blood vessels, which is a process called angiogenesis, and starts laying down fresh tissue. And then finally, the remodeling phase organizes that chaotic new tissue, cross-linking the collagen to make the scar really strong and durable.
Okay, but for millions of people worldwide, that ballet just completely falls apart. I mean, we're talking about chronic wounds, right? Diabetic foot ulcers, severe pressure injuries. The clinical data describes these wounds as getting chronically stuck in the inflammatory phase.
Yeah, and this happens because the local infrastructure around the wound is essentially dead. In patients with severe diabetes or vascular disease, the microblood vessels are damaged. There is practically no blood supply.
Which means no oxygen, right?
Right. Oxygen and nutrients simply cannot reach the tissue. And because of this starvation, the cellular signaling completely fails. The body lacks the vital growth factors to tell the cells, okay, the infection is clear, it's time to start rebuilding. So the wound just sits there, inflamed, sometimes for months, risking catastrophic infection or even amputation.
Which is terrifying. And that leads us to the first major biological weapon in our stack today, which is platelet-rich plasma, or PRP.
Yes, PRP.
The process is fascinating. So you go into the clinic, and the doctor takes a small blood draw from your arm. They put that vial into a centrifuge and spin it at high speeds to separate the red blood cells from the plasma and the platelets.
Right, they're isolating the good stuff.
Exactly. They extract this concentrated golden liquid, which usually contains 2 to 9 times your normal platelet levels, and then they inject it directly into the wound or apply it topically as a gel.
And the stats from the clinical trials on this are just staggering.
They really are. For diabetic foot ulcers, adding PRP increases full wound closure rates by roughly 5 times compared to standard care.
5 times. That's massive.
And for burn victims, it speeds up healing by an average of 6.7 days and massively slashes the odds of infection.
It's incredibly versatile, too. I mean, beyond chronic wounds, you see orthopedic surgeons injecting it for joint pain and severe tendon injuries. Dermatologists are using it for hair restoration. And, there's even the cosmetic vampire facelift everyone talks about.
Okay, let's unpack this. If you are listening to this and thinking, wait, if my blood is so good at healing, why doesn't a normal cut heal this fast? And why do we need a machine to spin it around? Doesn't my body inherently know what it's doing?
What's fascinating here is that your body is trying to send those platelets, but it physically can't. Think of a diabetic foot ulcer like a disaster zone after a massive hurricane. The body desperately wants to send in the relief trucks, the platelets, but the roads, the blood vessels, are completely washed out.
Oh, wow. So they just can't get there.
Exactly. By drawing your blood from a healthy vein, concentrating it in a lab, and manually injecting it straight into the wound bed, the doctor is essentially coordinating a massive airdrop, completely bypassing that broken vascular highway.
So you are manually delivering the supplies, but it's not just the delivery, it's the sheer volume, right? The sources mentioned that PRP provides a supraphysiologic concentration.
Right, supraphysiologic, which basically means way more than nature could ever deliver to that site at one time. Platelets aren't just for clotting. They're essentially biological backpacks packed with growth factors.
These are the signaling proteins like PDGF, VEGF, and EGF, right?
Exactly. When you inject that highly concentrated PRP into the tissue, those platelets degranulate. They burst open, releasing a massive autologous cocktail of your own signaling proteins. And because it's your own blood, your immune system accepts it immediately. No risk of rejection.
That's incredible.
It is. This massive shockwave of growth factors turbocharges the stalled system, forcing the wound out of that hostile inflammatory phase and jump-starting the creation of new blood vessels. The PRP gel even provides a physical fibrin scaffold, like a lattice, for the new skin cells to literally crawl across.
Man. But as our sources point out, PRP is essentially a shotgun approach, right? You're blasting the wound with every tool in the biological toolbox and just hoping the body figures it out. But the science hasn't stopped there. We also have a sniper approach.
Yes, and this is where we get into recombinant growth factors.
Yeah.
If PRP is just dropping the entire uncoordinated construction crew onto the site, recombinant growth factors are the highly specialized, lab-engineered architects.
Right. These are specific, purified proteins created in a laboratory, usually through recombinant DNA technology. Instead of spinning your blood, the doctor just opens a tube of highly engineered, factory-made gel and applies it. Let's look at the specific ones detailed in the clinical review. First, there's PDGF, or bacapilarmin. This actually has FDA approval.
Yeah.
It's incredibly effective at jump-starting pale, non-progressing neuropathic ulcers by recruiting fibroblasts.
And to really understand why that matters, you have to know what a fibroblast does. Fibroblasts are the cellular workhorses responsible for creating collagen.
Okay.
If you think of a healing wound, like pouring concrete, collagen is the steel rebar inside the concrete that gives it structural integrity. PDGF specifically targets and stimulates those fibroblasts to rapidly build that deep structural framework.
I love that analogy. Then we have EGF, epidermal growth factor. This is delivered via sprays or intralesional injections, and it specifically targets epithelial cells. The data shows it is highly effective in Cuba and parts of Asia for closing advanced diabetic foot ulcers and resurfacing superficial burns. Epithelial cells are basically the skin cells, right?
Correct. If fibroblasts build the rebar and the foundation, epithelial cells are the shingles on the roof. EGF triggers the rapid multiplication of these surface cells to finally seal the wound off from the outside world.
Makes sense.
And finally, the research highlights BFGFs, which is used heavily in Japan to accelerate deep tissue granulation, especially when you have exposed bone or tendon.
The contrast here is really striking. I mean, with recombinant factors, you get standardized high-potency dosing, A doctor knows exactly how many milligrams of the active ingredient you are getting.
Right, that's exactly.
Whereas PRP, on the other hand, is totally unpredictable. The quality of your PRP depends entirely on what you ate, how hydrated you are, and your own genetics on the day of the blood draw. However, these recombinant factors are tremendously expensive.
Very expensive.
They require strict cold chain storage to keep the delicate proteins from degrading, and crucially, they only target one single pathway of healing.
Which is a significant limitation.
Yeah.
Because, healing isn't just one pathway.
Here's where it gets really interesting. If I am sitting in a hospital bed with a severe burn, do I want the whole crew, meaning the PRP, or do I want just the specialist roofers, the EGF spray? Is there a world where we use both?
That is precisely the frontier of regenerative medicine right now. Clinical researchers are finding that synergy is the future.
Really?
Yeah. Preclinical studies are showing that if you take a lab-made recombinant factor, like EGF, and physically embed it into a gel made of the patient's own PRP, you get the absolute best of both worlds.
Oh, wow.
The PRP provides the broad biological stimulation and that physical fibrin lattice we talked about, while the high-dose recombinant EGF acts as the sniper to overcome the specific bottleneck of getting those skin cells to multiply. The results in complex wounds are vastly superior to using either one alone.
So we've mastered this biological soup, the concentrated plasma, the engineered proteins, but getting that soup into the right layer of a stalling wound or keeping it there so it doesn't just wash away requires a physical delivery system.
Yes, it does.
That's where the engineering catches up to the biology. Let's pivot to the newest medical devices on the market, specifically pulling from this fascinating list of recently approved tech from Japan's PMDA.
Hardware is really where we see these abstract biological concepts translated into physical, deployable engineering.
There is a device on this list that perfectly bridges what we were just talking about, the Silk Elastin Wound Healing Matrix. It's an absorbable dressing made entirely of recombinant proteins.
It's amazing.
You apply it to a complex weeping wound, and when it registers human body heat, it undergoes a phase change and turns into a protective gel.
Right. It acts as an artificial bioactive environment. It maintains the exact moisture level needed, protects the delicate new tissue from infection, and structurally supports the very cellular migration we were discussing with EGF and PDGF.
It's basically engineering mirroring biology.
Exactly.
But then the Japanese approval list takes a sharp turn away from critical care and into aesthetic and heavy-duty internal hardware. And this is where things get kind of wild. Look at the SoftWave system and the AviClear laser.
Oh, yeah. Bridging the medical and the cosmetic.
Yes. The SoftWave uses highly focused ultrasound waves to cause dermal thermocoagulation. It literally cooks microscopic portions of your deep skin layer to force your body to repair the damage, which tightens the skin and fixes wrinkles.
And look at the mechanism of the AviClear. It uses a diode laser that emits a very specific wavelength of light. That light passes harmlessly through the outer epidermis, but it is selectively absorbed by the sebaceous glands deeper down.
So it targets the glands?
Exactly. It intentionally damages the glands that produce oil, permanently downregulating sebum production to stop severe acne.
It's almost violently precise.
It really is.
And for the internal hardware, the list includes the Jetstream atherectomy system. This features a catheter that percutaneously enters your blood vessels, spins a blade, and literally vacuums out calcified vascular lesions.
Wow.
And there's the Visual Ice cryoablation system, which involves threading needles into renal tumors and using temperature sensors to grow lethal ice balls from the inside out, bursting the tumor's cell membranes.
The capability is just staggering. We are navigating the human vascular system with spinning vacuums and freezing tumors with internal ice probes.
So what does this all mean? We're injecting our own concentrated blood to heal diabetic feet, rubbing factory-made proteins on severe burns, using ultrasound to intentionally cook our dermis for wrinkle reduction, and firing lasers through our skin to fry our own glands to stop acne. Are we starting to treat the human body more like a machine to be tuned up rather than a living organism?
If we connect it to the bigger picture, you've hit on the exact paradigm shift occurring in modern medicine right now. We view the body as a series of mechanistic pathways that can be upregulated, downregulated, or mechanically altered.
Right.
But here's the danger. The tools are becoming as hyper-targeted as the biology itself. And with hyper-targeted, highly profitable tools comes the immense risk of the business model overriding actual medical necessity.
Because these machines aren't cheap.
Exactly. When a private clinic drops hundreds of thousands of dollars on a new laser system for wrinkles or a centrifuge for PRP, there is an intense financial pressure to run as many patients through that machine as possible.
Which leads us perfectly into the final and perhaps most complex piece of our deep dive. This tension between medical healing and cosmetic tuning is at the absolute heart of a fascinating study out of Saudi Arabia.
Yes.
They surveyed a wide array of health professionals and medical students about vulvovaginal aesthetics procedures, or VVAPs.
This is where the biological capabilities we've been marveling at crash head-on into cultural, ethical, and educational realities.
The data in this study is quite startling. Of the doctors, residents, and medical students surveyed, 68.7% admitted they lack substantial knowledge about these procedures.
That's a huge majority.
Right. Yet there is a massive surging market demand for them. We're talking about interventions like laser vaginal tightening, hymenoplasty, and G-spot augmentation. The market is exploding, fueled by social media, but the medical professionals themselves feel wildly underinformed.
And the study highlights a very clear dividing line when it comes to the ethics of these procedures among the medical community. The professionals surveyed were asked to distinguish between procedures addressing actual physiological dysfunction versus purely cosmetic alterations.
Right. Most of the professionals surveyed felt that using a targeted laser to treat vaginal atrophy, for example, in a postmenopausal woman experiencing severe physical discomfort and a loss of sexual function, was completely medically and ethically justified.
Because you are using the technology to restore necessary function.
Exactly. But when asked about purely cosmetic surgeries like hymenoplasty to artificially restore a biological marker of virginity, or labial surgery to achieve a specific aesthetic uniformity, the majority deemed those completely unjustifiable on medical grounds.
Furthermore, the participants strongly felt that if these procedures are going to be performed at all, they must remain strictly in the domain of gynecologists, not general plastic surgeons.
Okay, let's unpack this. We have a market that is aggressively pushing a highly specific, often doll-like ideal for human anatomy. We have a public that is heavily misinformed by the internet about what normal, healthy anatomy actually looks like. And we have the doctors themselves admitting in surveys that they don't know enough. Who is steering the ship here?
This raises an important question, and the authors of the Saudi study point directly to the underlying culprit here. They use a term called aesthetic deprivation.
Aesthetic deprivation.
Yeah. It's what happens when a population is deprived of realistic, diverse representations of the human body, usually due to the overwhelming prevalence of digitally altered media, social media filters, and pornography.
Wow.
Patients are walking into clinics experiencing profound psychological distress because their entirely normal anatomy doesn't look like an airbrushed image.
And instead of treating that psychological distress or, offering education, the business model of medicine says, oh, we have a laser for that.
Exactly. The commercialization of medicine is radically outpacing evidence-based training. The study's authors urgently recommend integrating aesthetic medicine and, crucially, the ethical considerations of it into standard medical school curriculums.
Which makes total sense.
Doctors need to be trained not just in how to operate the new ultrasound machine or the laser, but in how to guide vulnerable patients with shared decision-making, rather than just selling them a procedure.
It really is a double-edged sword. On one hand, we started this deep dive looking at the absolute miracles of modern biology. We're taking patients who were previously told they needed amputations, and we're using the biological airdrop of PRP to literally save their limbs.
It's miraculous, really.
We're utilizing the hyper-precision of recombinant proteins to rebuild the collagen framework of severe burns in record time. And we're seeing brilliant engineering, like Japanese medical matrices that absorb into a wound and phase change into a protective gel.
The capability to alleviate profound suffering and restore lost function is unprecedented in human history.
But on the other hand, the exact same understanding of biology, the exact same centrifuges, and the exact same lasers are being aimed directly at a hyper-lucrative cosmetic market. As these technologies become cheaper and more accessible, it won't just be professional athletes or the ultra-wealthy navigating this landscape.
No, it won't.
It will be you. You will increasingly be the one sitting in the patient chair or looking in the mirror, forced to navigate the incredibly blurry line between necessary healing and elective upgrading.
You'll have to critically evaluate whether a recommended procedure is truly serving your biological health, or if it's merely serving a clinic's return on investment for a brand new piece of hardware.
It makes you think differently about that simple X-ray machine we talked about at the very beginning.
Yeah.
The broken bone was simple. It was objective. But as we peer deeper into the biological matrix, the answers aren't just medical anymore. They are deeply philosophical. And as this technology scales, it introduces an entirely new dilemma. If our bodies can continuously be upgraded with recombinant proteins, lasers, and designer surgeries, at what point does the goal of standard healthcare shift from simply keeping us healthy to actively redesigning human biology for those who can afford it? Will we see the emergence of a literal biological class divide? Something to think about. Thanks for joining us in the deep dive.